breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone. Welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos. My co-host, as always, Dr. Glenn Harrison. How's it going, buddy?
Doing great. Doing great. I love this topic. I know you don't care for, but I love it. I love it.
You love it because you're good at it. I don't love it because I'm not as good at it, and I have not dedicated as much time as I probably should have to learning it.
Maybe, but we'll talk about it today.
There we go. Now I'm going to learn some stuff today, right? So today we are going to talk about estrogen and what are some concerns with estrogen, and in some cases, if it could be like detrimental to your health. If this is your first time watching or listening to the podcast, please hit like and subscribe and turn on notifications because we're going to continue to roll out new content like this each and every week. And hopefully you get some value out of it and we do something that's applicable to you. So let's talk about estrogen.
Estrogen.
What is it?
Estrogen is, I don't know, it can be your friend or your foe. I think it can be both. And more often than not, it's our foe. You know, we always hear this phrase that we live in a sea of estrogen. We actually literally do. We literally do.
We literally live in a sea of estrogen because now they're finding salmon off the coast of California that are testing positive for birth control.
That's right. And cocaine.
Yeah.
I don't know how that gets in the water, but maybe we'll save that for another podcast, another episode. But yeah, it's really important because there's a lot of people, both men and women, struggling with estrogen dominance and estrogen, we'll just say hormonal disorders. And most of the hormonal disorders that people are complaining about, they end up being some estrogen problem. And the maybe the most frustrating thing of the whole story is their go-to medical model. The go-to medical model is always about adding more estrogen in the body if there's a hormonal problem. There's always, or let's just say adding more hormone in the body, not necessarily estrogen.
Or HRT.
Yeah. There's testosterone and progesterone. Those are the big replacements out there. And no one's ever talking about, okay, hormones are a beautiful symphony. Everything is balanced. If we see low T or low progesterone, well, we really want to just add more in. Well, is it truly low, or is there another, or is there the inhibitory hormone, the antagonistic hormone like estrogen? Estrogen is the big bully in the room, suppressing all the other metabolic and energy producing hormones. And it is usually estrogen, but conventional medicine doesn't have a strategy to get that out of the body and to reduce the high estrogen, only to add in the other hormones. And then we end up on this big, race of hormones to the top, really higher and higher and higher. So, that's kind of the rant about estrogen. But there's a lot of things that estrogen causes dominance, some of the big ones, right? You see this in your office, Dr. Kolby. People say, oh, I think I have hormonal problems. I have hormonal problems. Well, what does that mean to them? Right. Well, they a lot of people will believe, weight is a hormonal problem. PMS symptoms. Well, they can be. They can also be other things. Sometimes breast tenderness and just all of the symptoms associated with problematic menstrual cycles. So you have a hormonal or irritability or fatigue. Everybody just points at hormones, and it can be. And in this scenario, we'll talk about it is, but not necessarily. But we do see that weight, infertility is a big thing. A lot of contributors, but hormonal, especially estrogen dominance, can do this. Reproductive disorders. I know you see this a lot in your
family. Yeah. I've found these before, like uterine fibroids or, polycystic ovarian syndrome or, endometriosis. All those type of things can be attributed to not just, but in, big contributors, estrogen.
That's right. And then what is the percentage of the population, the female population that come into your office between, say, I don't know, 19 and 38? What percentage of those end up with a diagnosis of fibroids, polycystic ovarian syndrome, or endometriosis?
Yeah.
Is it 30? Is it 40%? It's crazy, really. It's crazy how high it is. And it seems like every other or every third female that come into my office, there's a diagnosis of polycystic ovarian syndrome, and no one's really getting to the root source of it. So we're not even females, so we can't even experience it. but we see the trauma that people deal with. So there can be reproductive disorders that we just mentioned, autoimmune disorders. Estrogen is a favorite. Higher levels of estrogen, higher levels of autoimmunity. We're still learning about it, and we don't know the exact connections. Breast cancer. So most breast cancers are associated with estrogen dominance.
Yeah, I actually just had a patient that had an estrogen dependent cancer diagnosis, just like in the past couple of months. So that was, it can be pretty impactful. I think that a lot of people don't really think about how important the hormones are and the balance of the hormones, and the symphony of the hormones until all the instruments are out of order and it sounds like noise, and then something goes haywire.
That's right.
I was talking to this specific patient and they told me, they're like, I never once ever considered that like my hormones are something that I should have like really looked into and been proactive about managing until this happened. And now I'm realizing what a big deal it is.
You use a great term there, managing your hormones, because you can test them and you can actually see, pre and post efforts. Are they moving? Are they not moving? Doesn't require always pharmacology or hormone replacement therapy. I had 2 calls today. People asking if we do bioidentical hormone replacement. I said no. They said, well, how do you work with hormones? So then there was a conversation there. I guess I'll send them this podcast after.
There you go. There you go.
So yeah, so breast cancer can be associated with a lot of dominance of it, and a lot of factors for that, but that's a big one. And symptoms of low testosterone, which is pretty interesting. So a lot of people they'll say that if there is a problem with estrogen dominance, it means it's an antagonistic hormone, so it's working against testosterone. So if you have lots of estrogen, you inhibit testosterone, and it's pretty hard to have too much testosterone to inhibit estrogen. It's usually estrogen runs the show. And then you have low testosterone characteristics. So you can have a testosterone that's healthy, say 700 or 600 or 500, depending, as a male. But if you have abnormally high estrogen levels, your testosterone will act like you're at 200.
Right.
So the number isn't always the clinical.
It's almost the ratio of them. Yeah.
That's right. Exactly. It's a ratio. So symptoms of low testosterone is a common disorder associated with high estrogen.
And then that's going to be stuff like low energy, your libido is low. Like if your testosterone's out of whack, secondary to an estrogen issue, then you're going to have all this stuff of low T. Exactly. It's going to be low energy, low libido, that kind of stuff.
Yeah. Poor frontal lobe activity, inability to make split-second decisions, and confident with decisions. A lot of emotions tied to it, and cognitive processes. So those are just some things. And so where does this sea of estrogen come from? Right. Well, calling it estrogen is a little misleading, because there's these, what we call xenoestrogens, or fake estrogens, or chemical estrogens, environmental estrogens. And they're not a true estrogen. They're a chemical that act like estrogen. And then they do all the bad things estrogen does, and none of the good things, like, the weight gain, the emotional problems, all of those, the infertility, everything I mentioned, they do. They don't help with fertility. They don't help with soft skin. They don't help with thick flowing hair. The xenoestrogens, they do all the bad things. So this sea of estrogen comes from, the xenoestrogens and environmental estrogens. Plastics are a big one, some aerosol chemicals, but it's mostly chemicals. But it's not only, and we were talking about this earlier, it's not only about, when we think chemicals, it's not only about the foods, processed foods. It's also about, again, the air we breathe, the water we drink, the personal care products we put on our skin. A lot of chemicals in these, and a lot of times they're called endocrine disrupting chemicals. But these are xenoestrogens, and you can actually test them. You can test them with a test called Estrogen Total. I order that one on most people, and it quantifies both the natural estrogen and the xenoestrogen. It doesn't separate them, because it's hard to separate only the xenoestrogens, because they're really a chemical. But if you see a high load there, well, the individual should have, the
safe assumption.
The excesses has to be xenoestrogens. So then you got to, start working with that. But there's also natural sources of these as well. And we've talked about this too, testosterone converting to estrogen, like in polycystic.
That's when it becomes aromatized, right? And it turns into estrogen.
Right. Yeah. So you can have testosterone high enough and it'll convert into estrogen if there's a
Well, and then
problem.
that also like
Or estrogen, I should say, converting into testosterone. It can go both ways.
yeah, it can go both ways. And then you have to look at like where it's happening in the body, right? So it happens more in like in adipose tissue, correct?
Right. Mm-hmm.
Yeah.
Yeah. Yeah, for sure. So the more fat tissue you hold on to, you'll start converting your beautiful testosterone into estrogen.
Yeah.
And the more adipocytes you have, then the more conversion. There's other places, but that's the big one. And then you're like, well, where did all your testosterone go? Then estrogen is even more powerful and inhibits the remainder of your testosterone. But then there's also tissues that radiate estrogen, like fibroids. So someone is dealing with females dealing with uterine fibroids. Well, that's a estrogen problem to begin with, partially. And once they have fibroids, these fibroids radiate estrogen, increasing the burden and increasing the likelihood to develop more and more fibroids. So it just turns into this big mess. And then I've worked with patients all the time and we say, oh my goodness, they have mounds of estrogen. We got to get the stuff out of the body. Natural strategies isn't enough for someone who has fibroids. I'm working with 2 right now. We have to get surgical intervention. They have to come out. Also endometriosis, same thing with that. I've had females that I worked with, terrible PMS all their lives. It was horrific. There wasn't enough pain medication in the world to keep them sane for that period of time. And then conventional medicine just gives them contraceptives. It's kind of as far as it goes. And then they get frustrated with that. And then we're like, okay, well, we can only do so much. We have to get the endometriosis out. There has to be a procedure. And once that happens, there's a stepping stone, a springboard for the lifestyle strategies. Natural estrogens can also come from foods, like soy is a big one, but there's other ones as well. Or they can even be from hormone replacement therapy, bioidentical hormone. Well, I guess we can call that natural, but it's in a quantity that is our body can recognize. And I always feel like I have to tell people that I'm not anti hormone replacement therapies. I've seen places where it is absolutely necessary, but in the exposure that I have in the United States, I would say it's maybe 20% of what's going on out there. Yep. It's only about 20%. And we've done podcasts on hormones too. I can't remember what it was called.
Yep, we did. Yeah. I hated that one too.
Yeah. So then the question is like, well, we got all these problems and all this estrogen, and how do we know if we have high estrogen? Well, you can get it tested. You can find that out. The next thing is,
so say you get a test, right? And it's positive, like it's high, ratios all out of whack for T versus estrogen. And then the xeno versus phytoestrogens. So phyto is natural. Xeno is like, made outside the body. Then what?
Then what do we do? Yeah. Well, then we have to, ultimately want to look for the sources of it, right? Is there a lot of topical chemical creams? Is there, is the person, living?
Are you regularly microwaving plastic with your food?
Exactly. Exactly. And two people can have the same terrible lifestyle diet, but one person might have much higher xenoestrogens than the other. And that's their ability to detoxify. We did a podcast on detoxification, or probably a couple of them. So their ability to clean out the body can play a role, in the genetic factors and all of that. So the big player with hormones is, I always say there's 3 rules of hormones. You have to make them, you have to use them, and you have to lose them. There's 3 steps. And losing tends to be the biggest problem with hormonal dysfunctions, which seems so crazy when we're all about adding more, right? But losing them. And that's a detoxification pathway. Liver's the big one, but there's other tissues in the body. There's other systems in the body that are all about cleaning. But the liver's the big one. And we've talked about this in other podcasts. So you need the liver to run the way it should to be able to clean the stuff out of the body. You need to find ways to burn adipose tissue and to lean your body out. Now when I see someone's body type, I can predict ahead of time, are they going to have higher estrogens or less estrogens versus male or female? It's crazy what you can see. So when you said managing your hormone levels, that should be almost part of a wellness checkup now, blood chemistry, because I've even seen my estrogen creep up. I've seen it. When my body weight goes up a little bit, my fat tissue goes up, and then, you dial it in and it comes down again. And then your estrogen or your testosterone is more effective. And both men and women need testosterone.
Yeah. I think that's a common misconception too. It's like everyone thinks that that's just a male hormone. No, females make it too.
Yeah, exactly. And that's why it's handed out all the time, progesterone and testosterone replacement therapy. So there, I guess that's
that's the low and dirty of estrogen with Dr. Glenn.
Yeah, that's right. And you can test it, you can find it, and then you need to identify the sources of it, and then you need to pursue.
Get rid of it and clear it.
That's right.
Use it, make it, use it, lose it. Right?
Use it, lose it. That's it. That's all you got to do. So there's estrogen. Done.
Well, that was a good one, man. I mean, every time I talk to you about hormones, and we do it pretty regular because let's be quite honest, I'm not as good at it as I probably could be. Which there you go. Mark it up. That's my personal growth for 2023, right? But if you got value out of this or you'd like to contact us, we have an email associated with the podcast. It's info@brainstormingwiththedocs.com. You can put a comment down below. Again, hit like and subscribe, turn on notifications. If you'd like to look at our websites, mine is northlakeschiropractic.com. Dr. Glenn's is drgharrison.com. Full of information on there. There's a ton of podcasts out. I think that we just released like 126 or 7 at the time of this recording. So there's a lot of stuff back that you can look back on that's available to you as well. And stay tuned because we're going to make every effort to keep these things rolling out every week. And hopefully you find something applicable to you. So until next time, buddy.
We'll talk next time. Bye-bye.
All right, bye-bye.
Just before you go, sorry for interrupting, but just before you go, we got some exciting news, Dr. Kolby and I. We've been brainstorming and working on this podcast for quite some time, and we want to add another layer. So we've got some extremely exciting news coming up in the new year. Isn't that right, Dr. Kolby?
I love it. So 3.5 years in the making, and we're finally taking the next step in an effort to help you guys with your health concerns and conditions. We are actually going to be rolling out a series of courses on common health concerns. We have a rough timeline. We don't have everything laid out just yet. We are currently working on it, but starting the new year, stay tuned because we're going to be rolling out some courses that'll help a lot of you guys.
Yeah, so just stay tuned. We're gonna be announcing it soon. What exactly we're putting together, but just a heads up. So anyway, I hope you enjoyed the podcast and look forward to what we're going to be releasing here shortly.